Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from our readers, and the question last week was: my sister is in intensive care after a car accident with multiple fractures. The doctors want us to pull the plug. We want to keep going. What are our rights? You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of our readers. And the question this week is: my 78-year-old mother had 2 cardiac arrests. Are they keeping her ventilated and sedated for too long? This question from Ronald is an excerpt from a one-on-one phone counseling and consulting session with me. So, Ronald describes his situation as follows. He says, "Hi Patrick, my mum, who's 78 years of age, had a cardiac arrest 2 weeks ago and another cardiac arrest 4 days later. The first cardiac arrest was at home, and luckily my dad was there and called an ambulance straight away, and the paramedics were there within minutes. She then had the next cardiac arrest within 4 days in intensive care. She also had 2 cardiac stents fitted in the meantime, and she has now been put on the dialysis machine to help her kidneys. She also was in cooling therapy for about 3 days and heavily sedated. She was also on the balloon pump for 3 days after the second cardiac arrest, but it has come out now and they're saying that her heart is still weak after the cardiac arrest. They have been doing regular ultrasounds of her heart. Apparently she still needs some blood pressure medications and also needs medications to get her heart muscle beat stronger. Apparently her ejection fraction is only 20%, but I'm not quite clear what that means. She's also in an irregular heart rhythm now. What they refer to is atrial fibrillation. Again, I'm not quite clear what it means. Maybe you can help. She was sedated for 11 days in total, and it has taken 5 days for her to open her eyes. So should she still be ventilated with a tube down her throat, or should they be trying something else? Apparently there is no brain damage and the CT of the brain was normal. Any advice please would be much appreciated. It's been very difficult and frustrating for me and my dad, and I don't know which way to turn. They said she should have opened her eyes within 72 hours, but it took 5 days instead. Now she's blinking eyes to questions and trying to move her arms. What do you think? Should she be doing more of it? Shouldn't she be waking up now? Thank you very much." From Ronald, who's a worried son. So here is my response. Hi Ronald, thank you for your questions and thank you for using my one-on-one phone counseling and consulting service. First of all, it's good to hear that there is no brain damage, and it's good to know that your mother survived both cardiac arrest situations. Those are the good news. The challenges during those situations that you've described are indeed to look at what's happening after people have survived such a major event, and how they can get back on track as quickly as possible and get out of intensive care alive to take the next steps towards rehabilitation, if possible at all. Let's look at your mother's situation in detail. First of all, your mother survived 2 cardiac arrest situations within 4 days without having any brain damage. That, I believe, says a lot about your mother's will to live. Sometimes there is a bit of luck involved as well. As you've mentioned, the first cardiac arrest was at home and your dad was doing all the right things, and the second cardiac arrest was in intensive care. And if there's any place you ever want to have a cardiac arrest, it's either intensive care, the emergency room, or in the operating theatre, because there's trained staff around to manage those situations. Next, your mother came to intensive care, was induced into a coma, and she was put in cooling therapy, which is standard treatment after cardiac arrest in order to protect the heart, the brain, and all other major organs. You can also check out a couple of links to articles and videos that are related. One is, what is an induced coma and why is my critically ill loved one in an induced coma? And the other article and video that I put on there is, how long does a cardiac arrest patient stay in intensive care? Check out those links to articles and videos below this blog, below this video in the written version of this blog. So moving on, the aim during cooling therapy is to get the body temperature down to around 33 degrees, which is 91.4 Fahrenheit, and therefore minimize oxygen consumption for those organs, to slow everything down and get the heart and other major organs to recover, if possible at all. Next, your mother had another cardiac arrest after 4 days, and she then had 2 stents put in, also known as PTCA, to open up some blocked coronary arteries, which are the arteries supplying oxygen to the heart. Next, your mother needed the intra-aortic balloon pump to increase oxygen perfusion to the heart, which has shown to be effective after cardiac arrest. In the meantime, she has also gone into atrial fibrillation, also known as AF, which is an irregular heart rhythm, and this can happen after such events like cardiac arrest, heart attack, or after open heart surgery as well. Atrial fibrillation is basically when the 2 major parts of the heart, the atrium and the ventricle, are not beating in sync. During all of this, your mother has been placed in an induced coma, and she has been ventilated with a breathing tube. Furthermore, she is needing some inotropes or vasopressors because her blood pressure is low and because her heart muscle is weak. Therefore, your mother is needing either adrenaline or noradrenaline to maintain a sufficient blood pressure, and she would also need some milrinone or dobutamine to increase the contractility of the heart due to her heart muscle being weakened after the cardiac arrest. In some rare cases, levosimendan, also known as Simdax, is also being used for severe heart failure. They are now checking your mother's heart function regularly with heart ultrasounds, and they may have also done some cardiac studies with a pulmonary artery catheter. Your mother is now at the point where they have been able to remove the intra-aortic balloon pump, and where she had no more incidents of any further cardiac arrests, which is a very positive sign. Next, with the 2 cardiac arrests and everything that went along with it, she has gone into acute kidney or renal failure, which is why she needs the dialysis machine. And again, this type of situation after 2 cardiac arrests, 2 stents, also known as PTCAs, being placed, being on the intra-aortic balloon pump for a few days, and inotrope or vasopressor dependent, is nothing unusual after a cardiac arrest. Think about it, Ronald. With the heart being severely weakened after 2 cardiac arrests, and with blood pressure low as well as being in cooling therapy for several days, the kidneys would have been damaged due to low blood perfusion from low blood pressure and from being cooled. Many critically ill patients in intensive care go into acute kidney failure, especially after cardiac arrest, heart attack, heart failure, but also after multi-trauma and severe bleeding. Therefore, there are no surprises there from my perspective and from my experience. The good news is that the kidneys often recover in almost 90% of all patients that require dialysis after acute kidney failure in intensive care. And if there are no other kidney issues having been present prior to the ICU stay, they often recover fully. Next, you are saying that they are doing regular ultrasounds of the heart and that her ejection fraction, which is a measurement of the percentage of blood leaving the heart each time it contracts, and you're saying that the ejection fraction is only around 20%. It's really good to know that you are really on the ball, and it's great to know that you are asking them all the right questions. Well done. I'm not surprised that ejection fraction is only around 20% after 2 cardiac arrest events. This low ejection fraction is a sign that the heart muscle is severely weakened, and it means that the low blood pressure can be expected because of the low contractility of the heart muscle. A low ejection fraction would have also contributed to your mother developing acute kidney failure. In the ideal world, all of the issues that your mother developed because of the 2 cardiac arrests should be solved before she's getting out of the induced coma. But the situation after 2 cardiac arrest events can be quite complex, which is certainly the case in your mother's situation. Therefore, coming to the point where your mother has now been in an induced coma for 2 weeks and has survived 2 cardiac arrests is rather remarkable. You also haven't mentioned anything about the intensive care team being negative, which I think is great. Most families in intensive care who encounter a similar situation usually seek out my one-on-one counseling and consulting service because they are finding a very negative intensive care team. So far from what you are describing, you haven't encountered any negativity, and from my perspective they're doing all the right things. Now I want to address your question why your mother may not be waking up yet. And it's probably because she's not ready yet. Now, I know how frustrated you and your dad must be to watch your mother go through all of this treatment without being able to talk to her. Again, after such a severe critical illness and after being so close to death, please give your mother the time she needs to get through this, and this includes letting her wake up in her own time. During the cooling therapy, your mother would have been heavily sedated with midazolam, also known as Versed, and either morphine or fentanyl for pain relief. Both midazolam and morphine or fentanyl are long-acting sedatives and opiates. Opiates are also known as painkillers, and they take a relatively long period to get out of the body system, especially in kidney failure. And yes, the 72-hour time frame they have referred to after trying to wake her up after ceasing the sedation should have been sufficient time for your mother to wake up, and it took 5 days instead. I'm not too worried about it being 5 days instead of being 3, as long as she keeps doing all the right things. And she's doing all the right things from what you're describing. She's blinking eyes and she's moving her arms. That's great news. So I can also strongly recommend to check out other resources about when it's coming to waking up after an induced coma, or especially when your loved one is not waking up. You get all the information in those related articles and videos about not waking up after an induced coma in the links below this video in the written version of this blog. From everything you are describing, Ronald, your mother is making slow but steady progress. The fact of the matter is that no matter how much you, your family and the intensive care team want to speed up the process of waking up after an induced coma, critically ill patients do it in their own time, and your mother won't be any different from that. Again, keep in mind your mother had 2 cardiac arrest events within 4 days. She was on the intra-aortic balloon pump, she had 2 stents fitted, and she's now in acute kidney failure. That's a lot to deal with. Therefore, as long as your mother keeps making progress, that's all that matters for now. Give her the time to recover in her own time. And yes, she needs to get off the ventilator, but given that she was heavily sedated and is so sick, she may need a few more days to get off the ventilator. You can check out the video about what are reasons for not being able to come off the ventilator or respirator. Also, you want to make sure that your mother is really ready to be taken off the ventilator, because taking her off the ventilator too early could also be detrimental for her recovery. Therefore, give her a few more days. Imagine taking your mother off the ventilator too early, and then she might have another setback. This could be very detrimental, especially with an already weakened heart. In the bigger scheme of things, having survived 2 cardiac arrest situations within 4 days, no brain damage, and now having acute kidney failure, your mother is allowed to take her time to wake up. It sounds to me like she'll slowly get there. Intensive care is often a marathon and not a sprint. 2 steps forward and 1 step back. Your mother is already making progress. Give her a few more days and she'll be off the ventilator and be more awake. Again, so far your mother is not in an unusual situation after 2 cardiac arrests, 2 stents or PTCAs, the intra-aortic balloon pump, atrial fibrillation, acute kidney failure, induced coma and ventilation with a breathing tube. I really hope that helps, Ronald. Take care, and I wish you and your family all the best. So, how can you become the best advocate for your critically ill loved one? Make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care. You get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind the scenes insights so that you know what's really happening in intensive care. How to eliminate fear, frustration, how to stop being intimidated by the intensive care team, and how you will be seen as equals. You'll get crucial behind the scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section, where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone or via email by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.